I'm Simon Wornick, with my wife Anne. We've been in the constituency for 47 years, actually. Okay, my question. I'm an ex-GP, and I'm saddened to see that many who are still working are feeling disenchanted with their professional lives, and most would leave if they could. Demand is so great that they rarely feel able to spend the time with each patient that they would like to. All attempts to improve this worsening situation have failed so far. Do you have any thoughts and suggestions? Tricky? Good luck.
Thank you for your question. I'm very happy where the system's gone. You just pick out the first person to ask. So the first person to ask the question will be back to Simon.
Well, thank you very much, Simon, for your question. And thank you for your hard work as a GP. I know many GPs locally, and many people with their blood pressure who work with their heart and soul, and put their blood separate tears into their job, and I'm really grateful to have them. Now, I know that GPs have really had many challenges over recent years, particularly following the pressures of COVID. And in our local area, we have some GP surgeries where it's become simply arduous and challenging and too difficult to get access to a GP. Particularly, high-end surgery has been in my inbox for many, many years now. I've convened public meetings, I've raised this with the integrated care board because we need to get an action plan to fix it. On the other hand, we have other surgeries like Wickham surgery, which is an excellent surgery, which manages very well in terms of providing an excellent service for local patients. And I've met with the GPs and the management there at Kennedy. There's a real issue about the supply of GP services with the oncoming Knowle development. We'll come back to that later. But you've asked about workforce and quality of life for GPs. The government recently announced an NHS long-term workforce plan, and that's really looking comprehensively at how we provide for the long-term needs of general practice but the medical profession in total. It's about ensuring we have a pipeline of doctors coming through. I'm very glad since 2010 we've had thousands more GPs come on stream and into practice, whether it's general practice or in hospitals, and we've got thousands more nurses as well working here at Knowle. I've raised personally with the Secretary of State for Health the issue about the supply of GPs locally, because we do need more GP services here. As a result of that action, we've gone to NHS England and the Integrated Care Board to get an action plan in place to ensure that with new development and with the challenges facing the local community, there is a plan to ensure that the funding and resources there to meet the needs of general practice going forward.
We need to respond to our speed. There's 7 million plus people on waiting list for the NHS. We need to get them back to health. We need the 6 and 10 young people suffering from mental health to actually get to see someone urgently. And we have to rescue our social care services. And we're in different services. Our health and social care services have been driven into the ground. To answer your question directly, Simon, Delivery Democrats have a very clear plan to fix the front door to the NHS. We commit to employing 8,000 more GPs, giving you a guaranteed appointment within 7 days or 48 hours if urgent. We're going to do this by investing in GP retention and recruitment, as well as ensuring there are more medical and nursing skill places. We also need to free up GPs' time so they can spend more time doing what they love, which is actually face-to-face with their patients, by removing some of that admin burden. The other piece, there's so many other pieces to this. There's sort of the pharmacy first approach, which I do think is a great initiative, giving patients access to other ways of entering that front door and easing the pressures of GPs. We've got to be realistic about the huge damage that this government has done to staff morale. It's all very well coming out to clap for doctors and nurses during COVID, and then fighting them for their pay demands, and then asking for inflation level pay demands. This government spent more money on fighting our frontline staff than actually it could spend that money giving them their pay rises. So we're speaking to a lot of local GPs in this constituency, and I'd like to go back this time next year under a different government, and know that their hard work has been fully appreciated, that some of the pressures are starting to be lifted off their shoulders, and that they're actually enjoying their job again. If you vote for Reform or Conservative, you're voting to end the NHS and trying to determine to protect our NHS.
Hello. My understanding of this question is that it's about dissatisfaction or job dissatisfaction by the GPs. My suggestion, but I don't think having a plan is a very good answer. I mean, you can have a plan, then you have a plan for a plan, and all sorts of things. The obvious thing is to lighten the load of GPs by redesigning the work of GPs. For instance, there must be a lot of things that someone who is less qualified than a doctor can diagnose and treat. Simple kind of things that happen all the time. And for instance, in Spain, you can get things from the pharmacy, which you can't get, and you get advice from the pharmacy, which you can't get in the UK. So my suggestion, as part of the government plan, is to redesign the job of the GP to make the time available that you require.
Awesome. Was it? I think we agree with you.
Okay. It's always NHS. Anyone else in the room? Awesome. Sorry, they use the hands. They hold the thing and rewritten it. One of the words. Well, we're paying for managers who do all sorts of stuff. As far as doctors are concerned, GPs, any other doctor, we've got lots and lots of young people, very shy young people, very dedicated young people who can't get space at levels, aren't our space. I came across a student nurse at the University of Fareham. She's so important because Fareham sent it out. But her experience hospital is Winchester. So she got a 2-hour journey there, a 2-hour journey back, and a 12-hour shift. By the way, she's also got to sleep in sleeping and eating the other treatment. So the whole system just doesn't make sense. I recall when I was still in the line, he went through medical school years ago now, and the student nurses in the hospital, on the wards, doing theory in between time. They stayed in hospitals, and they were paid right from day one. Not a lot, but it's a lot better than coming out of the line where 50-odd grams worth a day. So we need to get more doctors trained. We need to retain more doctors. Now, one idea that Reform has is to suspend income tax for 3 years. The other idea is if you are trained as a doctor, we will pick up the tab, providing you work in the NHS for 10 years. It will be a pro rata. If you leave after, say, 9 years, you've only got a year of tuition fees to pay rather than the full amount. So this is giving practical cash help to people, but we need more doctors, we need more
negotiation of contracts, or those sort of things. And sometimes those of us who work in public health are a little part of that problem. Maybe I'll take some ownership there. Labour has pledged to reduce the red tape for GP and streamline commissioning so that burden is reduced. We also, it's not surprising that I'm proud of this, have a huge focus on prevention in healthcare. And what that means is working to keep the population well, so that we don't need as much care from our GPs. So providing 8,500 mental health professionals in our schools should immediately mean that families are not immediately at the front door of the GP surgery seeking help that they can't get elsewhere. Our short-term plan to reduce waiting lists dramatically would also mean that our GP colleagues are not managing people in pain indefinitely who are developing co-occurring conditions at the same time. That should also reduce the burden on our hard-working GPs. Now, we've pledged to reform primary care so that there is a return to the family doctor. And my pledge as a local MP is to listen to those people who are working in our stretched primary care systems, as well as patients, so that we can work together to build those